my experiences as well as experiences of the people that I know with their contact with hospital and the nurses and all that prompted me to think that this is one industry where a lot of change is really needed. And my focus has always been the education as well as health. These are the two areas where I think that the change has to really be effectively brought about. And when we want to talk about shifting anything, any process, the first shift has to happen in our mindset, our behavior. And I think that's where I could come in to do my bit.
You want to talk about behavior and cultural and whatever issues that come up with nursing or personal behaviors, relationship behaviors. I think I've got plenty to say. And that's it.
The thing that concerns me, not just here but in UK as well, is actually the training of nurses, which is now done in colleges, not in the hospital. As Mahinda, Vimla and I were all hospitally trained nurses, but going for study blocks. And basically the nurses come out quite insecure, I feel. And the transition from coming out as a nurse and practicing as a nurse is enormous. And to me it's very difficult for them, and they're not actually being given the most wonderful support, because they're dropped from the college and then they're independent. And we're having students come in every day for interviews. Some of them have been 2 years looking for a job. Nurses. And I feel there's got to be some time. I feel a lot of the colleges are, of course, motivated. They want the money. And we've at the moment got 5 that are newly trained nurses, and it's pretty difficult because their experience is very limited. And getting some of our senior nurses to want to teach them, that also is very difficult. They think Mahinda and I are totally responsible for teaching, besides doing everything else. But it's every nurse's job to teach. It's not just, it's everybody's role. And so, it concerns me really. And a lot of them are very put off when they first come into nursing, because they keep being told by other nurses they're no good at doing this and they're no good at doing that. And this is where I think there's a big area that we need to develop really, because I've talked about this many times to me, because if you're told you're no good all the time, you never will be any good.
Exactly, absolutely.
And but this does concern me the most, because they are the future of the nursing profession. I'm 63, I'm past myself by date. So, and I think we have to sort of leave some little thing behind us, and I think this is a way of doing it. It's how we do it.
Well said.
Well said.
Well said.
The critical success factor that is going to bring about a shift in the health industry lies with the people who are about to leave the industry.
Yes. Yes.
It's not with the youngsters.
No.
Absolutely.
Yeah.
So, changing the mindset, these are the people who is our absolute target market, to make them understand, to make them also feel important. You see, a lot of times, after working for several years,
But what saddens me where we work is we've got some excellent, very senior nurses, trained nurses, and they've got such negative attitudes. And I was saying to Dr. Rupi this week, there's only one person I feel in the trained nurses from Rupi Medical Centre that like new nurses, and that's Mahinda. I feel everybody else is like negative towards them on the whole.
I don't know whether it is a feeling of insecurity.
Threat, I think.
Do you think that the person feels threatened that there's someone younger and newer has come in? And what is that?
Probably not so, because if you are already overworked and if you are really exhausted, and if somebody is going to come and help you, you'll be happy.
Well,
right?
They don't see it like that.
The problem is, I guess, from what I've seen from other industries, and I'm sure it's the same here because people are people everywhere. It is an issue of generation gap.
Probably.
You have the traditionals born before 1949. You have those born before 1965, baby boomers. Then you have generation X, Y, and Z, right? The way all these groups of people grew up and understood and learned things are totally different. So one generation looks at, not the immediate generation, but look at the generation next to the immediate one, totally in a different light. So you have the senior groups looking at the generation. You say, a bunch of idiots.
Yes.
I don't know what they learned. But none of them would have gone to college with the intention of not doing well. None of them would have gone to college thinking that I'm just going to go there and waste my time. I think everybody would have gone there to say, I'm going to do what I can, my best.
Be a good nurse.
Exactly. But the people here look at them as in a totally different light. So change is not at that level, it's actually at the top level.
It is. I mean, can I just make a comment? One of our sisters made when I brought 2 new nurses on one day. What is she bringing in now? And I was so disappointed. I dread taking new people in. And she's an excellent nurse. This person is so fantastic. I wish she would only just pass it on. She's brilliant with the patients. She's a brilliant nurse.
So all she needs to understand is when you leave the industry, you're not leaving anything behind. Imagine now, when you leave, there's a whole group of people who remembers how excellent coach you were when you were there. And this is so they see the people at the top, they also need to know what is in it for me.
Yeah, and we had a group of...
What's in it for me? Why do I have to do that extra work? Am I already not inundated with so much to do? And now I have to coach?
This is what her attitude is.
But is it a Malaysian thinking?
No.
You see, we all
It's
train.
not. I've checked the other sites in US. They have exactly the same problem.
That's true.
It is the fear of somebody else stepping in your shoes, and that you become.
I think what Melinda said is
somebody who will take on your responsibilities, and you become a non-person or nobody. Insecure. I think that's one of the major problems that I've been reading from other sites in the US and UK. Same thing.
20 years of service, nobody taught me. They sit down here. I'll teach you how to do investigation. I'll teach you how to put up here. Nobody. They'll tell you, I went through a rough way. You also do it that way. Even trainers, we have training academy. Anything beyond and extra mile to teach you or to just do what they bid, that's it. And they find a few back markers, they don't bother. That's your business. So you see the mentality. Some
of them would have lost touch about what is really happening in the world. How fast is changing? If everything is moving so fast, and if you have not done anything to keep up with it, you are actually moving back. Right? Just standing still when everything else is moving, you're actually moving further and further behind. So you actually do not have a choice. As time moves on, every one of us need to update ourselves in the line of work what we are doing, and how many of us actually do it. That's one. Secondly, not only some of them are standing still, they're actually moving back.
Yes, they are.
So they need to come to understand that, is this the end, or can I be more? It's just to expand their mindset. I can actually be more of what I am already, because right now I'm here, I can actually move. So this is where all the retraining, the mindset, helping these people to understand change. Change is moving very fast. From the day when handphone was first introduced to now, the way and the speed of which the models keep changing, you can't keep up anymore, right? You know, it's unbelievable, because I remember when the first handphone came, it was those big briefcase.
Yeah.
That itself was around for a while. But then when it became more mobile, look at the speed of these things. So change is actually moving very, very fast. So one, understand why we need to change, and secondly,